Hello, everyone. My name is Zachary Brooks from UGenome. We make genomic medicine personal and accessible for everyone. I'm really excited today to be able to have a conversation with Dr. Jaden Lee, who's the Chief Genomics Officer for UGenome. Great. So, big question here, and you could just, as if no one has ever heard this before, but maybe they've experienced it. So, what are actually adverse drug reactions, and are they avoidable?
Yeah, so adverse drug reactions are unintended effects you get from the medication. So let's say I give you medications to lower your blood pressure. So lowering the blood pressure is the primary intention for giving you that drug. Anything outside of that is sort of considered adverse drug reaction because those are the effects that we didn't intend you to have. I tell this to all my patients that every drug has an adverse drug reaction. Even the medications that we don't think are causing trouble. So, for example, like vitamins, supplements, herbal products, things that we consider natural but in a pill form, they all potentially have adverse drug reaction. Sometimes you may not notice them because they're mild, but I say every drug has adverse drug reaction. And how you avoid it is really to make sure that you get the right medication at the right dose. Because sometimes, even if you get the right medication, the dose can be the problematic side of it. So if you get too much of it, you may get side effects. But at a lower dose, you might be just fine. So sometimes the adverse drug reaction heavily depends on sort of the doses. Now, that goes to, of course, the drug concentration in your system, which can also play a role within pharmacogenomics. So, pharmacogenomics here plays a role to help you choose the right dose or maybe even completely avoid it if you have a system, health system, where you're not metabolizing the drug quick enough so that the drug accumulates too much. So in the cases like that, it will help you to sort of choose a different medications to avoid adverse drug reactions.
Got it. Thanks for that. So what really stood out there is that we could define every medication as having a reaction. We only talk about adverse drug reaction when it crosses a certain point, a certain threshold, and start to cause us problems, which is really kind of a fascinating way to think about drug reactions. We always have reactions, but do they harm us or not? That's kind of the big question there, right, Jaden?
Yes. So in addition to that, certain medications, the dose is really not relevant. So some medications, if you have a certain genetic variant, you are just at a high risk of developing severe reaction, whether you get a small amount or a high amount. So definitely there are some genetic variants that for example, like G6PD deficiency can lead to hemolytic anemia with certain medications. So you do need to watch out for that. Sometimes the dose is not the only answer.
Excellent. Thanks. So maybe building on that, what's an example of a person who's had an adverse drug reaction?
So I personally had a interesting story of a patient who was taking this like a natural herbal product. I don't remember exactly the name of the drug, but the patient was taking it because she heard good things about the herbal product and the immune system. Later, it was really found out. It was really found that it was toxic to her liver, so she actually had a liver failure and was put on a liver transplant list. That was a very severe sort of a case of adverse reaction. On the other hand, of course, I had cases where when I used to manage a lot of patients with diabetes, they'll take GLP-1 antagonists and they'll have constipation. But the medication works really well. Their blood sugar is good, they're losing weight. So constipation was an unfortunate adverse drug reaction, but it wasn't something that they couldn't manage. But the benefit of the drug, the GLP-1 antagonist was so great that the patient was willing to manage the constipation. So patient will go get laxative or stool softener to help with constipation. So it really depends on the benefit of the drug and how undesirable the adverse drug reaction is. So sometimes you will have to sort of balance the pros and cons in that kind of situation.
Yeah, I mean, I think you gave us the spectrum pretty well, right? Like you can manage on one hand constipation because it helps you on the other side of the medications you're taking, but then this other person, the reaction was so severe they needed a life-saving organ transplant, a liver transplant in this case. So, where would like maybe an example of something between those two extremes?
I think it kind of depends on the clinical situation. So how severe the reaction is and what we are trying to address here. So in certain cases, like I can think of an example as like a metformin. So metformin is another drug for diabetes, and we usually do not give metformin in patients with kidney disease, but severe kidney disease because it could accumulate and lead to a severe side effect called lactic acidosis. So you really need to sort of monitor the level. So things like that, it really could tip over to one side or the other. So those will be more careful situation.
Great, thank you.